This is a hint from Howard on aesthetics, beyond bleaching, minimally invasive tooth whitening. I'm Howard Strassler. We're going to talk about choices for minimally invasive tooth whitening, alternatives to traditional bleaching techniques. And the techniques we're going to talk about are macroabrasion, using a fine diamond with water spray on a high-speed handpiece. We're going to talk about microabrasion, using a hydrochloric acid with an abrasive in it, the products Opal Luster from Ultradent and Prima from Premier Dental. And we'll also talk about resin infiltration as an aesthetic treatment, as a tooth whitening. We'll be using a hydrochloric acid etch and then be doing a resin infiltration using the Icon product. So let's talk about the indications. The indications for these alternative whitening techniques are stains or defects in the enamel only, conditions such as dental fluorosis, localized enamel hypoplasia, hypocalcifications of the enamel that are superficial in the enamel, and white spot lesions on enamel surfaces, demineralized enamel adjacent to orthodontic brackets, patients who haven't done such a good job at removing bacterial plaque. So here we're looking at two situations where we see fluorosis, and the case on the left-hand side is a mild to moderate case of fluorosis, and on the right-hand side a more moderate case of fluorosis, the brown and white modeling of the enamel surfaces. And the other condition that could be treated with these alternatives are white spot lesions. And here we're seeing white spot lesions caused by bacteria sitting on the tooth for long periods of time. And as you can tell, this patient had orthodontic treatment with bonded brackets and did an inadequate job of removing the bacteria, the plaque from the teeth during orthodontic treatment, leaving these white spots. When we talk about microabrasion, we're talking about using a high concentration hydrochloric acid or using a diamond or finishing burr to remove tenths of a millimeter of enamel where the enamel is superficially stained. We're talking tenths of a millimeter, not the white opaque spots that teeth can sometimes have. We're talking about superficial stain that can be removed, and these are mild to moderate fluorosis cases, hypocalcification, and enamel demineralization. And really, it may not be effective using these techniques, and we need to evaluate it case by case. In some cases, when this technique is not effective, we may go to a little bit more invasive treatment with a composite or porcelain veneers. So let's take a look at a case report. Here we have a patient with moderate fluorosis on their maxillary central incisors, and those are the only teeth we're treating. Note that the incisal edge of the laterals and the incisal third of the canines also have these white spots. But we're going to focus on just the two centrals. We're going to use a fine diamond, as you see here, with a high-speed handpiece with significant water spray when we're removing this superficial enamel to tenths of a millimeter. We're talking very shallow. We're using a flame-shaped fine diamond. After we've removed the superficial enamel that was stained, we then polish the surface up, leaving us with this post-op appearance. The teeth are then treated with fluoride trays. Now, in this case, we may still continue to go to bleaching, but at least we have a start. And bleaching many times is not effective to these brown mottled appearances of fluorosis. So let's look at a combined case where we're using macroabrasion with a fine diamond and microabrasion using a hydrochloric acid abrasive paste. And then we're going to do some bleaching for these teeth. So we see mild to moderate fluorosis. We then go in with our fine diamond with significant water spray and a high-speed handpiece, and we abrade the superficial enamel. We're talking tenths of a millimeter, 1/10, 2/10, 3/10 of a millimeter, keeping the enamel surface somewhat flat, more aesthetic looking. We then treat it with Opal Luster, and here we're looking at a 6% hydrochloric acid silica abrasive paste that's placed on the enamel surfaces. And because it's hydrochloric acid, notice that we have a dental dam in place. We could just as easily use some of those resin-based paint-on dam materials that we use for 1-hour whitening. We place the gel on the teeth, and we're going to remove the gel and abrade the gel on the teeth using a specialized cup that has a brush in it, running it at no greater than 1,000 RPMs. 1,000 RPMs. The patient must be wearing eye protection. We don't want any of this paste getting in their eyes. And in the top image you're looking at, on the left-hand side, I've done just half the teeth with one abrasive. You can see the enamel looks etched, and we're starting to we've lost the luster from the enamel. On the right-hand side, we can see that we haven't even touched the enamel surfaces. So we're removing superficial enamel. The hydrochloric acid's far more aggressive than phosphoric acid, and that's why we're using that. Here we've done the enamel surfaces one time. We're starting to even out the discoloration. We're seeing the underlying enamel surface once we get past the superficial discoloration. Now we've applied the paste 3 times. Notice how etched the appearance is on the enamel. You can see that the surface itself has a more even tone. In fact, the white spots, the white spotting seems to pop up because the teeth are dehydrated. After I've done several, and typically no more than 5 applications, taking about 10 to 20 seconds each, rinsing it off, and typically when rinsing it off, using the suction right on the teeth, I then will do a fluoride treatment after I've polished the enamel, and you can see the enamel is now more lustrous. And then I go in with an MI paste, which is a amorphous calcium phosphate or fluorides. We have done significant acid attack on these enamel surfaces. So here we're looking on the upper left-hand side, the preoperative view, and then the postoperative view. And notice we've removed most of the brownish stain. Much of the white speckling is gone. We've evened up the appearance on the mid of number 8, the middle of that tooth, and we've really achieved a significant aesthetic result. The patient wants them a little bit whiter. In fact, with this technique, sometimes the teeth will look yellower because we're removing the white speckling. We then do 2 weeks of tray bleaching. So on the upper left, we're seeing after the original treatment, and then 2 weeks of tray bleaching. In fact, we can take the bleaching out as far as 6 weeks with tray bleaching using either a hydrogen or carbamide peroxide gel. Now let's take a look at this patient 2 years postoperatively. We see color stability, and the aesthetics is something the patient has very much desired. Now there's another technique. We can use resin infiltration using the system Icon. And Icon's very unique because Icon basically has a hydrochloric acid etchant. After we've etched and rinsed the teeth, we then need to dry all the water out of the tooth using a drying agent, which is an acetone. We then go in with a resin infiltrant, and this resin is a hydrophobic resin, hence we need to have these teeth very dry, and we need to isolate these teeth before treatment, either with a traditional rubber dam, with some of the paint-on dam materials we use for 1-hour bleaching, or DMG also has these mini dams for placement that really work quite well using this material. So let's look at the technique. We apply the etchant for 2 minutes, rubbing it on the surfaces. We then wash and dry the tooth, and we remove the etchant first with a high-speed evacuator, getting all the gel off before we rinse and dry. Once again, it's a hydrochloric acid. We need to protect the gingiva. We need to protect the patient's eyes. So we need isolation. We then apply Iso Dry, which is an acetone to chase all the moisture from all the enamel surfaces. We do that for 30 seconds, then dry the tooth significantly, and then we apply our resin infiltrant for 3 minutes, applying it to all the surfaces where we etch. And we don't necessarily have to etch the entire tooth, but only where the white spots are present, where the speckling is present. And as I said, always protect the soft tissue from the hydrochloric etch. So let's take a look at some cases from an article from Journal of Restorative Dentistry in 2015. On the top slide, you can see the appearance of these teeth, uh, a hypocalcification of the teeth. In fact, these patients, the two patients you'll see, are two sisters who have celiac disease, and tooth discolorations is a potential consequence of celiac disease. And so you can see the developmental enamel defects. Using the resin infiltration of using Icon, you can see we've changed the appearance. And we do that by actually changing the translucency of the teeth, allowing light to transmit better with this resin infiltrate. And for this second case, once again, this is a sister of the first patient, same condition, celiac disease, enamel defects causing discoloration, and treating the facial surfaces of the maxillary anterior teeth with Icon, we're able to achieve an aesthetic result for this patient. This has been Dr. Howard Strasswood talking to you about Beyond Bleaching with a minimally invasive tooth whitening procedure. I think you'll find that these techniques offer an adjunct to times when you're doing bleaching where you want to do some additional treatment to the stained, discolored superficial enamel before bleaching.